Thank you very much. I am Dessalegn Shamebo from Ethiopia, and I am working in Ethiopia Civil Service University, Department of Development Economics. I am happy to join the GAIC Network. The title of my dissertation is Social Capital in Maternal Healthcare Use in Northern Ethiopia. Just to provide a sort of background information pertaining to the subject, traditional economics assumes that health status and healthcare use are largely subject to individual control rather than influenced by social factors that affect behavior. It doesn't incorporate social interaction in health production. However, in recent years, it is recognized that health status and healthcare use are largely related with social issues. In this regard, nowadays, the development of research on social capital is providing a new perspective in understanding the social foundation of human action. So far, different studies have been conducted on the role of social capital on different outcomes, like health and employment. So in this research, we see the role of social capital on maternal healthcare use. Just again to provide a sort of background information on maternal healthcare utilization status in rural Ethiopia, as the report of the 2011 Demographic and Health Survey report shows, only 26% of women received antenatal care, only 5% of births were attended by health professionals, only 4% of births were delivered in health facilities, only 2.7% of women received postnatal care in the first 3 days after giving birth, and only 22.5% of women used modern contraceptive services. These very low healthcare utilizations are caused by both demand side and supply side factors. As a result, maternal mortality and morbidity remains high. Therefore, doing this research has two very important functions. First, in Ethiopia, maternal health care is universal. It is free of charge. Every woman has equal access to maternal health services. Eligibility is not a question. However, this access is not fully translated into use, despite huge investment made by government in expanding health facilities and deployment of health professionals. So this study helps us to see why this is the case. Secondly, the majority of Ethiopians are living in rural areas where social interactions are the main source of information in determining a number of factors, including maternal healthcare use. Here, modern access to information is scant. So, this study analyzes the role of these social interactions, especially social capital, on maternal healthcare use. To do this research, I have used mixed methods. The qualitative part helps us to link theoretical issues with what is on the ground. And the quantitative work helps us to analyze the role of social capital on maternal healthcare use. To conduct the qualitative work, I have used focus group discussion and key informant interview, and accordingly, lack of in-depth knowledge pertaining to services provided at health centers and health forces, awareness of mothers, close family members, especially husband and mother-in-law, perception of illness severity by women are found to be very important factor behind underutilization of services. In conducting the quantitative work, I have used structured pre-tested questionnaire. Here, I have collected information on social capital, especially this on 4 dimensions of social capital, and maternal healthcare utilization, like prenatal, delivery, postnatal, and contraceptive use. Together with this, I have also collected information pertaining to economic and demographic factors that are assumed to be determining healthcare use. Currently, I am writing the findings of the quantitative work, and I am also writing the design for the last section, just taking one dimension of social capital, that is social network. In short, this is what I did so far. I hope I'll come up with findings in 2016. Thank you very much.